Hi, my name is Rachel,
And my name is Darla.
and today we're going to be talking about CAUTI. So, what is CAUTI? Well, it's the most commonly reported hospital-acquired condition, and according to the ANA, more than 560,000 patients develop CAUTI each year. That doesn't really answer our first question. What is CAUTI? CAUTI is a catheter-associated urinary tract infection. This type of urinary tract infection is caused by bacteria entering the urinary tract through the catheter. This bacteria then colonizes and forms an infection. UTIs are one of the most common healthcare-associated infections. 75% of those infections are related to indwelling catheters. The CDC states that 15 to 25% of hospitalized patients had been given a urinary catheter at some point in their stay. CAUTIs have been associated with morbidity, mortality, an increase in healthcare costs, and an increase in the length of hospital stay.
Patient-related factors for acquiring CAUTI include age, gender, lifestyle, anatomy, and disease process. Nearly half of all women will acquire a UTI over their lifetime due to the short length of the female urethra. Patient-related factors for increased risk of CAUTI include primary risks: a female over 50 years old, if the patient has diabetes, urethral colonization, debilitated health, incomplete emptying of the bladder, fecal incontinence, and then secondary risks of dehydration, sickle cell anemia, immobility, other sites of infection, previous UTI, or colonization with resistant organisms, and poor personal hygiene.
So, what are the causes of a CAUTI? So there are many contributing factors to CAUTIs. Some of those are poor catheterization association, like Darla was saying, or practitioners' inexperience or lack of knowledge regarding the correct procedure, poor maintenance care, or incorrect drainage tubing and collection bag. So now that we are aware of what CAUTI is and what causes it, some of the related factors, let's look at how to prevent it. So according to the CDC, some of the biggest ways we can avoid CAUTIs are by inserting catheters only at appropriate times and leaving in place only as long as needed. To minimize urinary catheter use and duration in all patients, especially in women, the elderly, and those with impaired immunity. Avoid the use of catheter use in long-term care to manage incontinence. So instead of just putting a catheter in your patient who has incontinence, maybe just toilet more often and do things like that. Use other interventions. Consider using external catheters like condom caths as an alternative to indwelling catheters in cooperative males. Perform hand hygiene immediately before and after catheter insertion. If breaks in a septic technique, disconnection, or leakage occur, replace the catheter and collecting system using a septic technique and sterile equipment. Keep catheter tubing free from kinks.
Caregiver-related factors for increased risk of CAUTI include not washing your hands properly prior to catheter manipulation, inappropriate use of catheters, drainage bags, spigot, tube contaminated when you're emptying the catheter, to make sure to sterilize and use alcohol wipes so that you don't introduce bacteria to the catheter itself. Catheter left in place longer than necessary. Poor insertion techniques, breaks in closed system, and other methods for a client to control incontinence, not used or tried. Fully bag if it is raised above the level of the bladder. We had a we talked about bundles today in class, care bundles. And there was information on a bladder bundle, and it had aseptic insertion and proper maintenance is paramount. The bladder ultrasound may avoid indwelling catheters, condom or intermittent catheterization in appropriate patients. Do not use the indwelling catheter unless it is a must.
Mm. And the signs and symptoms of CAUTI kind of look the same as a normal urinary tract infection, except there's not an increase in urgency because there's a catheter and there is no pain during urination, but you can see the other signs of an infection. So there could be an increase in white blood cells, there could be a fever or confusion. Confusion's a big one. Sometimes in our patients, all we'll see is confusion, especially the elderly. So although we can take all of these preventative measures, sometimes CAUTIs will just happen. So what should we do once, if a CAUTI does end up developing? So according to the Lippincott resource, we should remove the urinary catheter and obtain a urine specimen for culture. Then replace the catheter if it is still needed and obtain a specimen from the new catheter. Doing so helps determine whether a true infection is present. Administer the antibiotics as prescribed. Review the patient's case to identify any additional opportunities for staff regarding catheter use. Regardless of the cause of infection, document in the patient's permanent medical record your initial observations and patient assessment, including signs and symptoms of infection, the practitioner notification and orders obtained, interventions performed, the patient's condition and response to interventions, and any patient and family teaching provided, their understanding of that teaching, and whether follow-up teaching is needed. And that's all we have for you today. Thank you.
Thank you.